Welcome back, everyone. There's nothing worse than struggling to get pregnant. About 5 million women have PCOS, and about half of them don't even know it, and it could cause infertility. Dr. Jeremy Grohl of Spring Creek Fertility is here with more on what is going on. First, explain what it is.
So polycystic ovary syndrome, that's going to be the single most common hormonal imbalance in reproductive age women. And there's a lot of confusion because largely from the name, the polycystic ovary, and really it's not about ovarian cysts. That is an effect of the hormone imbalance and the metabolic problem that's actually driving the whole process. And so really it's defined by women having high testosterone with irregular cycles or trouble ovulating and what we call polycystic appearing ovaries. And so you would need to have 2 of the 3, and that would meet the criteria.
Why is it so hard to diagnose, or why half of women aren't diagnosed?
Well, and with some of that, the symptoms of high testosterone are pretty obvious in that we would have folks who have either hair growth on facial hair, the chin, the upper lip, or maybe scalp hair thinning. We may have folks who have irregular cycles, and so if they've got infrequent cycles, that's going to show up. But we could meet the criteria just by having a high testosterone level, even though it's not showing up, as symptoms. And they may have the ovarian features, but meanwhile have regular monthly cycles. So it's easy to slip through the cracks.
And right there, this is how women are affected.
Yes, and so one of the biggest things, now people can get the syndrome through many different ways. It might be an overactive enzyme, it might be some other factors, but the most common, by and large, is trouble with your sugar metabolism. And so that if people have what we call insulin resistance and have high insulin levels, it's the insulin that drives the testosterone. It also throws off what we call the LH surge. That's the trigger to ovulate. So directly, insulin causes the 2 main features there. But also, it causes trouble with babies implanting. So we have as high as a 40 to 50% chance of miscarriage.
Wow.
And that is primarily due to the high insulin levels. So as far as really the metabolic problem leading to everything else, once we get the sugar metabolism and the insulin in check, everything else falls back into place. And so that now, unfortunately, there's a lot of feed-forward mechanisms at play, and it leads to weight gain oftentimes. It leads to trouble, kind of snowballing. So once we see the symptoms, it's kind of hard to get that to reverse. So a lot of folks, they see some things, make some changes, and it kind of stalemates. So that's where a lot of our additional interventions really come into place, because we then hit that metabolism from the food we eat to absorption into the bloodstream to how it's processed, and then at the tissue level, how your body turns that sugar into energy is really the biggest part to control it most effectively.
You have such great information. If someone has any questions, how did they contact you?
So we're right over at Spring Creek Fertility. It's at 458-5084, and we're right over in Centerville.
Doctor, thank you. Appreciate it.
Thank